So, Chapter 2, Concepts of Health, Illness, Stress, and Health Promotion. Here you have the 5 theory objectives that will be accomplished in this chapter. Compare traditional and current views of the meanings of health and illness. Describe what the word health means to you. Define what sickness means to you. Discuss why nurses need to be aware of cultural, educational, and social differences that might exist between themselves and their patients, and compare cultural, racial differences in disease predisposition and communication between the main cultures and different races. Here you have the clinical objectives that will be accomplished. Observe patients during and the data gathering process and interview process and determine their views on health and illness, and recognize cultural differences in healthcare concepts and behaviors in a clinical setting, and be able to share those observations with fellow students. Okay, so the meaning of health is different for everyone. Some people look at health as basically the absence of disease, so not having disease, while others view health as optimal function on every level. So I'm at my optimum level of functioning on every level. Um, we have a couple different definitions even defined. Miller King Dictionary defines health as a relative state in which one is able to function well physically, mentally, socially, and spiritually in order to express the full range of one's unique potentialities within the environment in which one is living. In 1946, the World Health Organization redefined health as the state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity or sickness. So, what's your view of health? So, it's important for you to understand what your own view of health is. Why do you think that is, right? Um, it is important for you to define what you believe health and illness mean to you, because your perception of these terms influence what you say and do when you're caring for your patient. So you need to be aware of your own viewpoints. A lot of different things can impact or affect a person's view of what health is. Maybe their culture defines what health should be for them. Their educational level can influence their view of health. Their social influences can also influence who's who's telling them things, who's talking to them, who's influencing them. Those individuals, those things can influence what your view of health is as well. All right, so let's look at different types of illness. Let's talk about the difference between chronic illness versus acute illness. So, chronic illness, that's an illness that develops slowly over a long period and lasts throughout life. So, it takes a long time for it to develop, but it lasts throughout your life. For example, arthritis. It takes a long time to develop, but once you have it, you have it. Um, Congestive heart failure. That's a chronic illness. It takes a long time to develop, but once you have it throughout your life. Acute illness. What is that? Acute illness is illness that develops suddenly and resolves in a short time. So something like influenza, which is the flu, that develops suddenly, but it will resolve. You take the medication, get you some rest, nutrition, and fluids, and it'll resolve in a short time frame. Pneumonia, that's also an acute illness. So things that develop suddenly and resolve in a short time. A terminal illness has no cure, and death is inevitable with a terminal illness. So we have some other types of illness, primary versus secondary illness. A primary illness develops without being caused by another health problem, whereas a secondary illness is the result of that primary illness. So let's give an example. A person has hypertension and has a mild stroke. So the primary illness is the hypertension. The secondary illness is the stroke because the stroke resulted from the hypertension. Because they had hypertension or high blood pressure, they had a stroke. That's why they developed, it's why they had a stroke. So the stroke is the secondary because it was a result of the hypertension. Let's look at another one, peripheral vascular disease and diabetes. So um, diabetes is the primary illness and the peripheral vascular disease is the secondary because the peripheral vascular disease developed as a result of their uncontrolled diabetes. So the diabetes caused the peripheral vascular disease. So the thing that caused the second disease is the primary, and the secondary disease is what was caused by the primary. Let's look at some other ones. If you have an idiopathic illness, that means the cause is unknown. That's what idiopathic means, cause is unknown. If you have a genetic disease, that means it was inherited. The disease was inherited. So, for example, sickle cell anemia is an inherited disease. It was inherited from your parents. Maybe it was inherited from your mother, inherited from your father. And then if you have a congenital disease, that means it's present at birth. Maybe you have a congenital heart defect. That means that heart defect was present when you were born. All right, so you have 3 stages of illness: transition, acceptance, and convalescence. During the transition stage, you have some mild symptoms, but you're in denial about those symptoms. So, for example, you start sniffling or whatnot, and so you're in denial that you are developing a cold. You just say, "Oh, that's just my allergies." You're in denial that you're developing a cold. That's just my allergies. You've heard people say that. That's just my allergies or whatever. So in the transition stage, there's some symptoms there, but you're just denying that you're getting sick. Acceptance stage, that's when you accept or acknowledge that I'm ill. So, yeah, I realize this is a cold, and so I need to take measures to improve my health. So maybe you start or improve these symptoms. So maybe you start taking cold medications or whatnot, or depending on the issue, you may need to go to the doctor and get some antibiotics or something like that. So you acknowledge illness and you start taking measures to become well. And then in the convalescent stage, that's when you start to recover and regain your health. So you start feeling better, you start recovering in the convalescent stage. Okay, so let's talk about the difference between health behavior and illness behavior. Health behavior includes any actions or behaviors that promote health and prevent illness. So things that you do to promote your health or prevent illness from occurring. So maybe you get an annual physical exam. Maybe you exercise regularly. Maybe you get your immunizations. Maybe you have good nutrition. So things that you do to promote wellness and try to prevent yourself from becoming sick. Illness behavior, so those include actions to diagnose and treat a health problem. So I have an issue, so now I need to do something to try to diagnose this issue or treat this issue. So maybe I consult a physician, maybe I consult a nurse, maybe I consult a pharmacist. As a result, I start taking um, medications or whatever. Maybe, I got to go to the urgent care or the clinic or something like that. And so, that's illness behavior. I have something going on, so I'm trying to diagnose and or treat the issue. All right, question 1. Illness occurs in 3 stages. All of the following stages are stages of illness except so the answer is 4, terminal stage. There are 3 stages of illness: a transition stage, which is the onset, the acceptance stage is when you are sick, and then the convalescent stage is your recovery stage. Okay, Jane has hypertension and has recently suffered a mild stroke. This diagnosis is an example of, so the answer here is 2. A secondary illness, such as a stroke, results from or is caused by a primary illness, which is hypertension. So remember, the secondary illness is caused by the primary illness. And so in this case, the stroke is secondary and the hypertension is the primary because it caused the stroke. An idiopathic illness is one that has no known cause. And then a terminal illness is incurable and it ultimately results in death. So these are objectives for our next part of this chapter. The theory objectives list the components of holistic healthcare, identify the four areas of human needs and give an example within each level of need, identify ways in which the body adapts to maintain homeostasis, and then the clinical practice objectives determine the patient's status on Maslow's hierarchy during a clinical experience and describe alterations in homeostasis as observed in the clinical setting. So, as nurses, we have to provide holistic care to our patients. We have to take a holistic approach to providing care to our patients. So, that means we need to not only do we tend to the patient's physiologic needs, yes, we have to attend to their illness, their injury, or whatever. Has brought them to us, but we also have to tend to the patient's psychological needs, their sociological needs, and their spiritual needs as well. So that will provide a holistic approach to caring for our patient and promoting wellness um, in all areas. If they're not spiritually healthy, then it may be difficult to tend to their physiologic needs as well. Same thing with sociologically or psychologically. We might use various other non-pharmacologic techniques as well to help tend to some of these needs, such as acupuncture, acupressure, biofeedback, meditation, or relaxation techniques as well. So Maslow's hierarchy of needs. This is another thing that you will take with you throughout nursing school. We'll talk more in depth about nursing process, but and that helps you identify prioritize. But Maslow's hierarchy of needs also helps you to prioritize patient needs as well. So it's a humanistic model and it identifies 6 levels of needs. So a person's needs must be met on the lower level before striving for the higher levels. If you look in your book on page 20, there is figure 2.3 that goes through Maslow's hierarchy of needs. So that the hierarchy describes human needs that motivate behavior. And if one level is not met, a person is not motivated to move to the next level. So your lower level is your physiologic needs. Then you go up to your safety and security, then love and belonging, then self esteem and self actualization. So we'll go in more detail in the next couple of slides here about that. So on that first lower level there, that includes fundamental physical needs that are essential to maintain life. So things that might be included in that might be your oxygen, your food, your water, your elimination, so bowel and bladder elimination. Even sex could be included in this lower level as well. So if things are not met in this level, you can't move to your next level. The next level is safety and security. So things included in safety and security. Do you feel free from harm? Do you feel comfortable in your environment or whatnot? So that would be your next level. And then the next level up from that would be love and belonging. So under love and belonging, do you feel love? Do you feel affection? Do you feel intimacy? Do you have a social interaction with individuals, family, all those things? And so the idea with this Maslow's hierarchy, like I said, if one level is not met, you can't move to the next level. If my oxygen needs aren't met, I can't focus on you're trying to teach me how to give that injection. I'm having difficulty breathing. So I can't think about that next, moving on to the next level or whatever if my lower level needs are not met. Okay, the next level up would be self-esteem. Under self-esteem is, do you feel self-respect? Do you feel recognition, appreciation, independence, competence, motivations? What's your spiritual beliefs like? And so that's what's included in self-esteem. And then the final or the top layer is self-actualization. A lot of people actually don't reach this level in their life. But so that's reaching one's full potential. You're comfortable with yourself and certain beliefs and values that you might have. You're self-reliant. You're flexible. You're open to new ideas. Um, you're creative. You're able to problem solve. Things like that is what's included in the top level of self-actualization. Okay, homeostasis. So your book defines homeostasis as a tendency of biologic systems to maintain a stable internal environment by continually adjusting to changes needed for survival. So homeostasis is basically the body's ability to maintain stability. So how does it do that? The body is constantly making changes to adapt. So for example, if an infection is introduced into the body adapts by increasing the body's temperature and trying to fight off that infection. So the body maintains health and wellness or regains health by adapting to stressors in the environment. And so if the body is able to adapt, then wellness is achieved. However, um, if the body tried to adapt and was not able to adapt and illness resulted, then that's called maladaptation. Okay, general adaptation syndrome or GAS. So the general adaptation syndrome is the body's response to long-term exposure to stress. So if the body is exposed to stress for an extended period of time, how does it respond? So there are three stages to this GAS: alarm stage, stage of resistance, and stage of exhaustion. In your book on page 26, figure 2.7, there is actually a diagram that goes through these various stages. And so during the alarm stage, hormones are released to get the body's uh, defense mechanisms going. So you might have an increased temperature, loss of energy, a decrease in your appetite. You might start having a feeling of malaise. Make sure as you're studying, if there's words that you come across that you don't understand, you look those words up because it's highly likely you'll see those words again. Malaise just means feelings of weakness, tired, or whatnot. In the stage of resistance, the body is fighting for equilibrium. So fighting to get back to, for equilibrium. So if the stage is long, you have maladaptation. And remember we said when maladaptation occurs, illness occurs if this stage of resistance is a long period of time. And then stage of exhaustion, the stress is so severe or present for such a long time that it starts to deplete the body's resources, and either A, critical illness occurs or death occurs because you've had this stress for such a long period of time. Maybe you've had this cancer for so long and the body's been fighting off, or you've had this, whatever this disease is, so long, and so the body just gets depleted and you become critically ill or ultimately die. I also want to bring to your attention on page 25, box 2.2, some stress-related diseases. These diseases or disorders occur as a result of prolonged stress. Um, or can occur, I should say, can occur as a result of prolonged stress. Headache, gastritis, asthma, low back pain, connective tissue diseases, ulcerative colitis, irritable bowel syndrome, allergies, hypertension, cancer, sexual dysfunction, Crohn's disease, eating disorders, infection. These are just examples of things. Now, that's not to say that that's the only reason these things occur, but stress can bring on these things or exacerbate these diseases or disorders. Okay, so let's look at question 3 here. A teenage drug addict who has lost numerous jobs states, I do not have a problem with drugs. Everyone uses them as much as I do. I can quit anytime. This is an example of which coping mechanism. So the answer here is denial. We'll go over coping mechanisms here in our next section, but this is what an example of denial would look like. Denial is a more serious form of repression. The person lives as though an unwanted piece of information or reality does not exist, and so they're in denial. So in this case, the person is denying they don't have a problem with drugs. So we're going to talk about coping mechanisms a little more detail here. All right, so in this section, these are objectives we'll cover here. Theory, explain why a particular stressor may be experienced differently by two people. List the common signs and symptoms of stress. Identify 4 ways in which a nurse can help decrease stress and anxiety for patients. And then in clinical practice, document observations about stress reduction techniques used by staff or patients during a clinical experience. So stress can be good stress, it could be bad stress. Getting a new job can be stressful, but I mean, you may consider that to be a good thing, but it still can be stressful. Getting married, that's a good thing, but that can still be, stressful for on a person. Um, Illness, those are stressors as well. A lot of different things, losing your job, that can be stressful. So a lot of different things can cause stress in a person's life. And it's just the same, a lot of things can impact the way a person reacts to stress. What is their perception of the stressor? Do they think it's a good stressor or a bad stressor? What's their degree of health and fitness? If they're not that healthy, then the stressor could weigh on them a little bit more. What's their previous life experiences and personality? If they've had bad experiences with stress in the past, then this may affect them a little bit more than someone else. Um, Available support systems. Do they have support systems available? Personal coping mechanisms. Are they able to cope properly? Do they have proper coping techniques to be able to cope with stress? So, some things you might look at. Why is that stressing that person out so much? It depends on a lot of different factors as to why it stresses them out more than it would stress you out. If you look in your book on page 27, box 2.3, those are some common patient stressors, things that stress your patients out. Sharing a room with a stranger, that could be stressful for a patient. We're not going to go through all of them, but let's just look at a few of them here. Having to wear an ill-fitting gown that opens down the back, that could be stressful for a lot of patients. I know I've been stressed out, and they say go in this room here and put on this gown and then come out here, and then you're worried about, oh, is it closed in the back? And that's stressing a person out. Being uncertain of the diagnosis and what will happen, that could be stressful for a person. Not understanding medical terms, so we shouldn't be using a lot of medical jargon for our patient. That could stress them out. Being left on a stretcher in a hall without sufficient warm covers, that could be stressful. Having different personnel providing care each day, that could be stressful. So these are some things that can be stressful to your patients. So keep those in mind as well as you're caring for your patients. Coping. is how a person deals with a stressor. And different people are going to cope in different ways. Three main ways people cope are they do something to change the situation. So uh, maybe they're stressed out about um, not being able to find a job that they enjoy. So they change the situation by going to school. So do something to change the situation. They change their thought about how they view the situation. So changing your thought process and how you view this. Maybe don't view it um, in a bad way. I lost my job. So don't view it in a way that, oh, this is horrible. Maybe view it in a way that's positive. This is a good thing. Now it opens me up to explore other job opportunities. So change your thought on how you view the situation and then control your thoughts to stop the stress reaction. So don't sit there and dwell on the situation and how it's going to hinder you in life. So control your thoughts to stop the stress reaction. So there are several defense mechanisms or coping mechanisms that people use to deal with stress. In your book on page 27, there's a table 2.3. Make sure you understand each of these different defense or coping mechanisms and how people um, deal with stress. So we won't go through all of them, but make sure you understand all of them. Let's just look at a few of them here. For example, repression. So repression is the unconscious blocking of a wish or desire from conscious awareness. So the example the book uses, you forget the name of someone whom you have intense negative feelings. So the person was so negative in your life that you repress them completely. You forget all about them. You forget all about them, right? Denial, that's the one we just used in our question. That's escaping unpleasant anxiety causing thoughts by refusing to acknowledge their existence. There is a persistent refusal to be swayed by evidence. So, for example, in our question we had, there was evidence showing that the person had a drug problem, but they continued to deny, I don't have a drug problem. I don't have a drug problem, right? Let's look at another one. Regression, returning to an earlier level of adaptation when severely threatened. So the example the book uses, a child resumes bedwetting after having long since stopped after the birth of a baby brother. So they were not bedwetters, they're 10 years old, but they were so stressed out when they had a baby brother that they reverted back to bedwetting. Rationalization, unconsciously falsifying an experience by giving a contrived, socially acceptable, and logical explanation to justify an unpleasant experience or questionable behavior. A student who did not study for an examination blames their failure on the teacher's poor lecture material and unfairness on the examination. So rationalizing why they didn't get a good grade instead of just saying, I didn't get a good grade because I didn't study. They want to rationalize with all these other things. Let's look at just one more here, displacement. Discharging intense feelings for one person onto another object or person who is less threatening, thereby satisfying an impulse with a substitute object. So the example the book uses, a child who has been scolded by their mother hits the doll with a hairbrush. So they're displacing their anger on the doll with the hairbrush. All right, some positive techniques a person can use to decrease stress. We got a lot of different positive techniques we can use to decrease stress. Progressive relaxation. Relaxation is a way to try to decrease stress. Imagery. So that uses visual stimulation to produce a physical change. So the person can do imagery themselves, or you can do guided imagery where you guide them through a scenario, or they can do it themselves. And so if you were doing guided imagery, you would just guide them through, maybe say, imagine yourself on a beach sipping your favorite drink with the wind blowing through your hair. So you take them to a relaxing place and help them to relax, or whatnot. Massage therapy is another stress reduction technique. Biofeedback. Biofeedback. So electrodes, they're not shocking, but they're electrodes that are placed on you, and uh, the goal is to train the patient to decrease the symptoms by controlling their internal processes that are normally involuntary. So, like your heart rate, your blood pressure. So, they're training you to decrease these things and thereby being able to cause relaxation or decrease your stress. It can also be used to decrease pain in individuals as well. Yoga that combines exercise and breathing techniques to help. Some people use it to relieve pain. Some people use it to relieve stress as well. Meditation is also another stress reduction technique. And so with meditation, you're focusing all your attention on a single stimuli to, and you go to relieve all your mental um stressors or mental, just release everything from your mind and reduce your stress level. Regular physical exercises that helps to release endorphins, and that can decrease stress levels as well. So I also want to bring your attention to page 28, box 2.4. um, those are some measures to you as the nurse can do to help reduce stress and anxiety in your patients. So we won't talk through all of them, but make sure you read through all of them. So let's look at a few of them. Explain everything. Explain everything. The hospital routine, how to use the TV, how to use the lights, how the curtain works, procedures, diagnostic tests. Explain everything to your patient so that can help reduce stress in the patient. Listen carefully, answer their questions. That always, that's one way to reduce stress. Always knock before entering. Provide privacy. All these things reduce stress. Answer call lights promptly. We always teach you to make sure that the person has their call light within reach. However, if you don't answer those call lights, that increases their stress level as well. So many times I've gone into clinical settings and the patients are so stressed out because they say, I've been pushing this call light for 45 minutes and no one has come to help me. That increases their stress level. And stress, in turn, the more stress they have, the more exacerbated their disease can be. So reducing stress can help your patient as well. The Healthy People series, I believe it started with Healthy People 2010, and then it went to Healthy People 2020, and now we're at Healthy People 2030. So every 10 years, um, new goals are designed. And so it was created by scientists as a comprehensive set of objectives for disease prevention and health promotion for the nation as a whole. And so trying to improve the health and well-being of the nation. And so on page 28, box 2.5, there are some overarching goals for Healthy People 2030. And so we'll just look at a couple. So the first one is to attain healthy, thriving lives and well-being free of preventable disease, disability, injury, and premature death. And so if you go to the Healthy People 2030 site, you will see uh, there's actually a link on Blackboard for you, and you'll see all the goals in all the various areas. Let's look at the second one: eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. So these are just the goals, some of the goals and things that were designed to try to improve the health and well-being of the nation as a whole. All right, health promotion and illness prevention. Those are strategies a person takes to decrease the risk of illness. So, things that you might do, right? So we have primary prevention, secondary prevention, and tertiary prevention. In your book on page 27 at the top there, there's some health promotion behaviors that's included in each of these areas. So if we're talking about primary prevention, those are things that we do to avoid or delay occurrences of disease. So things that you do to try to keep from getting sick or whatever. So maybe you don't smoke, maybe you eat a well-balanced diet, maybe you exercise regularly, avoid dangerous behaviors. So those are things you do to prevent illness or disease. Secondary prevention, those are following the screening guidelines for individuals. So maybe you have your regular colonoscopy or mammogram or whatnot to identify diseases early. And then your third one is your tertiary prevention. So tertiary is rehabilitation measures after a disease or disorder has stabilized. So maybe you had a stroke and you have go to rehab after having that stroke or something like that. Okay, question 4. A nurse should minimize stress for a patient whenever possible. A common measure to reduce stress is, so the answer here is number 4, all of the above. And so explaining procedures, listening carefully to the patient, answering questions, and providing privacy reduce stress by meeting basic security needs as identified by Maslow's. And so, in addition, the measures provide respect and dignity for the patient as well. All right, our last question, question 5. A charge nurse is reviewing a student's charting. Which descriptive term might be considered inappropriate when charting an assessment? And so the answer here is non-compliant. We'll talk more in detail about this when we get to the documentation chapter, but assessment must be done without criticism, with an open mind, and with active listening. So non-judgmental terms such as non-compliant, uncooperative, ignorant, lazy, or unmotivated should not be used to describe another person's health or behavior. And like I said, we'll talk in more detail about that when we get to the documentation chapter and what we should be documenting and how we should document.